Bladder cancer is the cancer of urinary bladder. That is where the urine stores before we void out. So it is one of the most preventable cancers that is there, and especially in elderly. And how do we prevent it? Because 60% of the association of the bladder cancer is with tobacco usage, especially with smoking. If somebody stops smoking or avoid tobacco completely, they can reduce the incidence to a great extent. And there are so many changes in the treatment modalities and screening and monitoring of urinary bladder cancer, with the role of chemotherapy going out and more into a personalized way. And most importantly, in spite of such an advancement, still early diagnosis plays the important role. Why it is important? Because if diagnosed early, bladder cancer may not even require a surgery. It can be just treated with a local treatment alone. That gives a very good upper hand, and it is curable. So how to diagnose this cancer early is by not ignoring the symptoms. Blood in urine is often multiple times treated as urinary infection and no imaging is done. It is very important to understand why there is blood in urine. Is it just a stone, or it is just an infection, or there is something else in the bladder that is being missed out? Or frequent urinary infections which are happening. Why frequent urinary infections are happening? It is important to understand the reason for behind these frequent issues, and necessarily investigations to be done by the physician so that we can diagnose this early. If diagnosed early, then we can completely avoid the surgery. What if it diagnosed little late? What are the treatment advances that are there? So we are personalizing the treatment in such a way that we understand what is the burden of the disease and what is the treatment to be given to avoid surgery or to avoid even chemotherapy. There is a very good role for immunotherapies and newer drugs called antibody drug conjugates, which are chemo-free regimens and are tolerated very well. Even for 80 years old, 85 years old or 90-year-olds, the tolerability is quite good. I was mentioning the age, but still age is still a number. It all depends upon the physical fitness. So age doesn't mean that they should avoid screening or stop visiting a doctor. That also needs to be investigated, because there are better treatments, better treatment modalities which are tolerable, that will avoid chemotherapy and give a very good healthy quality of life.